Medicare Supplement Plan N. Hi, Sean Brady here with My Healthcare Direct, and we are an independent insurance agency. We work with all the insurance carriers in your area, and we are trying to educate as many seniors as possible on Medicare, how it can impact them, what are the difference with the plans, and today we're going to be going over Medicare Supplement Plan N. If you like what you see on this page and you would like to receive more content, go ahead and like and subscribe and click the bell. When more content comes out weekly, you'll be notified. If you have any questions at all during this video, shoot me an email or give me a call. Either me or my team will go ahead and get your questions answered. And yeah, that's what we're here for. So, okay, Medicare Supplement Plan N. Let's dive in and see what we can learn. So, Medicare Supplement Plan N is going to be one of your popular ones, okay? You're going to be hearing about Medicare Supplement Plan G, Plan N, Plan F. A lot of folks have that. So let's look at the breakdown. Okay, so Medicare Supplement Plan N, it's going to be similar to Plan G with a couple differences. So one of the main ones is going to be your Part B coinsurance or copays, okay? So your Part B copays are going to be after your Part B deductible is met. So what does that mean? So your Part B deductible is going to be your $203, okay, for next year, 2021. Once that has been met, the $203, then you would have to pay for your doctor's visits. That's your Part B, okay? So your specialist, primary care, that sort of thing, you would have to pay a copay for those visits. So how much would the copay be? Great question. It's going to be $20 for your doctor's visits, and then it's going to be a $50 copay for emergency room, okay? So every time you visit the doctor, expect to pay $20 copay. Every time you go to the emergency room, if not admitted, expect to pay a $50 copay. And that's how that works. The other expenses that you would need to know about and would be required for you would be your Part B excess charges. So in a way, this is very similar to Plan G. The only real difference is going to be the excess charges as well as having to pay copays after you meet your Part B deductible, okay? And that's from January 1st through January 1st. It's a calendar year, okay? Now, other things to consider. Well, Sean, how much would this cost specifically, okay? So your Plan N cost, you first would have to have a monthly premium amount, all right? And that cost is going to be a little less than I would say a Plan G, all right? Because there's more cost that you are responsible for, all right? Like your Part B deductible, but more importantly than the difference between Plan G would be your doctor visit copays. Remember, that's going to be a $20, up to a $20. Could be less, but the maximum would be a $20 per visit. And then emergency room would be up to a $50 copay. Could be less, but that would be the max. And then you'd have your Part B excess charges, okay? So that's Plan N in a nutshell. And what other things would you need to understand about it? So you'd have your Plan N excess charges. Sean, what are those? Those basically they occur if providers do not accept Medicare assignment, okay? Doesn't happen too often, but just want to explain it so we understand. Providers can charge up to 15% of Medicare approved amounts, all right? How to check for excess charges. We have it, go ahead, we have it listed here where you can go to medicare.gov, type in this right here, physician compare, and first you can look up the zip code, you need the doctor's name, but you can go ahead and figure out, would there be excess charges? What would they be? Okay, and see in the next slide here, how to check for excess charges. You see, here's a doctor, Gregory Joffrey Jones. Okay, so he would accept Medicare approved payments, and you see the little check mark there. If you really want to find out, that's the way to do it, okay? It's a great option, I would say, for, if the premium's less than $30, if it's $30 less than Plan G, I would say it's a great option, but it really just kind of depends, and we can help you do the math and figure out what the best fit is for you. Like I said, there's a lot of options that people have, a lot of people explaining different things. We're basically here to educate you, to help you make the best decision to fit your needs. Along the way, I'm sure there's questions and different situations arise. That's why we're here. We've heard most all of the different situations, so we're here to help you not make same mistakes that others have in the past. Give us a call. We'll be glad to help you.